Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, this is Michael P. Coleman, Content Director with Brother Be Well. Today, in one of a series of Brother Be Well conversations on trauma and healing, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're speaking with marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs, about the physical health impacts of trauma. Christian, welcome back to Brother Be Well.
Hi, Michael. How's it going? Thanks for having me.
Really good. Good to have you back again, Christian. Can't wait to get into this topic with you today.
I can't wait to get into this myself. I'm ready to
We, you know,
roll.
we've talked a lot, Christian, about trauma as a part of this series. There may be someone in the Brother Be Well family that's not yet seen one of those videos or listened to one of those podcasts. So, really briefly, a couple sentences, if you could, summarize trauma for that person and kind of give us a frame for why we're talking about trauma.
Sure. Yeah. For the individuals who may be wondering what trauma is, you're really looking at four categories of trauma, and in which they can occur, which is fight, flight, freeze, or fawn. And those are four different criterias or areas, I should say, that trauma could occur in. And we also talked about, really trauma in terms of different types of trauma that can occur, such as chronic trauma, which happens very intermittently. It can happen throughout someone's life. Complex trauma, where you're dealing with several layered issues that's causing the trauma that's ongoing, that maybe in your community environment is constantly occurring. Then you have acute trauma, which is something a trauma that happens at a short time. It's really a very sharp and powerful event that you may have witnessed, or something that may have happened to you personally.
So important that we talk about trauma. We've talked about it again here. We've talked about some of those impacts and how they can really impede our overall development. Can you talk about the impacts of trauma that the impacts rather that trauma has on our bodies and on our physical health?
Sure. Well, trauma really impacts our overall physical and emotional health, but the physical part, a component, is really important because sometimes mentally, as things impact us mentally, it can eventually turn physical. For example, as someone is stressed out, right? Someone is stressed out from work, or they're experiencing extreme trauma at work. That emotional stress and trauma can turn into body aches, which thus can turn to hypertension or blood pressure. And it's all being induced from a physical issue. So as you experience stress, your heart rate increases. As your heart rate increases, your heart is working harder. When that's happening over a long period of time, that's where the risk for hypertension and high blood pressure can come in. And then the body aches is something very similar too. Your body's working a little harder, so those body aches could be contribute to a couple things. Your body can really be going through that issue in terms of pain, or your brain could be sending false signals to your body, making you think that you're injured or you're hurt, and you're really not. Which also happens in a lot of individuals who are suffering through dealing with withdrawals through opiate abuse, things of that sort. So those are some of the similar traits that go along in terms of physical, and also in terms of impacting one's sexual drive or impotence as well. So for men and women, it could impact their sexual drive and their inability to want to be involved intimacy with their partner, things of that sort, and also erectile dysfunction issues. So there's several physical components that can really impact a person's overall ability when you're talking about trauma.
As you know, Christian, when you and I get together, we sometimes have a physical health practitioner, a nurse, or a doctor here with us. We don't have the benefit of that today. So let's just pause for a second before we get into some of these physical health challenges. And could you talk about the importance of checking in with your primary care physician? These are not symptoms that you should take lightly or ignore. Can you talk about why it's so important that you check in with your doctor on this stuff?
Michael, you know why it's really important to check in with your doctor? Because you're talking about mental health and physical health, right? So I'll give you an example. If you are going to school and you are working in your chemistry class, and in order to pass your chemistry class, you have to work with a TA. And you decide not to work with that TA, you continue to just basically try and learn the stuff on your own, go to class, and you're not working with that TA who's a connection to the professor, right? It's almost the same concept when you're talking about this topic here. So when you're looking at an individual who is a primary health provider, they are that connection, they are that link to the mental health world, in a sense, to your resources and your referrals. So they can refer you to the appropriate person after they've completed their assessment. So it's very important. Working with a medical doctor allows you to really tell your story on what's going on and receive the proper assessment based on your condition. And also working with your primary health provider, it also connects you to medication if needed. And I know the medication component may be difficult for some because they may not understand how medication works in terms of dealing with something like PTSD, for example. So that's why working with your primary health provider can really explain and provide some psychoeducation on how medication can assist you in terms of your journey through traumatic experiences, and really ensuring that and this is on the patient side, right? This is more that patient advocacy component. You're really ensuring your doctor, you can do your homework to ensure your doctor understands your story and seeking a second opinion if you aren't happy. As we know that there's been talks about in terms of patients feeling like they're not heard, and certain populations feel like they're not heard, or their condition being taken serious by their practitioner. So you have an opportunity really to open up that door to see and ask that doctor, what their specialty is, and if they have referrals to someone who specializes, who's a trauma informed and also culturally competent. And also, really in the community, sometimes there's a misunderstanding, or thinking that you shouldn't question the doctor, you shouldn't ask them questions on their knowledge, but you really can. You can ask them, what they specialize in and what they have access to, and you can also ask if they don't contain those specializations, where they can send you to.
It's pretty powerful, Christian. Before we move on, it hit me as you were summarizing that for us. There's something powerful about two black men talking about go talk to your doctor. When you say we are sometimes the last people, I know men seek medical care. We're slower to get to the doctor's office generally than women, and black men, we are known for trying to power through something by ourselves and not checking in with your doctor. So there was a powerful second where I thought, black man talking to black man about going to talk to your doctor, somebody's going to be impacted by this. So I appreciate you walking us through that. Want to talk about our next question here. Some in the Brother Be Well family may be surprised to hear that if we leave some of those conditions unchecked, some things like anxiety and depression can lead to some very, very real health problems. I'm thinking about stroke. I'm thinking about heart attack. Can you make that connection, Christian, between the how our bodies are going to process that unchecked stress and what can come around the corner or down the road if we don't pay attention to it and seek some treatment.
Absolutely, and this kind of goes back to your comment about two black men, talking about this topic and the distinction and the connection, the correlation between how black men suffer from heart disease and hypertension and high blood pressure, due to not going to the doctor at the right time or waiting until it's too late. So these are some of the health conditions that correlate with sometimes us not wanting to go to the doctor. And one of the issues of that is that sometimes when we wait too long, it's sometimes harder to really pinpoint where the condition started, or where some of the, and also kind of work on some of the conditions so we can improve them. So one thing that comes to my mind is arthritis. Studies has been shown really that, arthritis is one of those serious health conditions that could really develop through long and induced experiences of trauma. And that's that mental component, right? That's now affecting the physical component, and they go hand in hand. Heart disease, as we talked about, stomach ulcers. So we talk about stress. Basically, stress really changes and again, we'll probably have some doctors or someone here on the physical side talk about that. But stress really does change the makeup of the stomach, and what's going on in the stomach, which is why acid reflux can be a sign of stress, things of that sort. And also your constant rapid heartbeat, which also can lead to several issues. So just imagine your heart rate moving faster than what it normally shouldn't or doesn't do. That could also cause some physical implications too.
Absolutely. And I know from experience, if that heart is beating more rapidly or stronger than it really should, and you combine that with high cholesterol, which a lot of people of color and specifically African Americans and specifically African American men deal with that, it's a recipe for I started to say disaster. It's a recipe for a stroke, is what I've learned. So we've got to pay attention
Absolutely.
to those things. We got to pay attention.